Globally, vagina from the beginning of time have been created to stretch as much as possible. Obviously, as we can see during childbirth. Now, if they are interested and your partner is safe and has done all the needful during foreplay, then you two can make it rain no matter his size. Yes! Welcome to Triple F with Dr. OBeLs. This show is rated 18. Now, if you are menopausal or you're breastfeeding or you just give birth and you experience pain during sex, well, it may not be too shocking. However, it becomes strange and abnormal if you find yourself in none of the situation and you still feel pain during sex. And medically, we call this dyspareunia. Sex is not supposed to be painful, and it should be noted here that dyspareunia is completely different from sadomasochism, where couples derive sexual satisfaction from inflicting pain during sexual activities, like we saw in 50 Shades of Grey. Well, that is a topic for another day. I had a patient who got married as a virgin but always dreaded having sex with her husband. Why? She always experienced pain during sexual intercourse and she always couldn't wait for her husband to travel. And that is so sad. She was diagnosed with vaginismus, and this is a condition where you have involuntary contraction of the pelvic floor muscles that makes it painful for you to have sex or makes it difficult for your partner to penetrate. It is mostly due to emotional and psychological causes. Beyond vaginismus, though, there are several other factors that can result in painful sex, ranging from physical, psychological, to medical. Most women who have experienced painful sexual intercourse may experience it before, during, or after sex, and it may be associated with burning sensation, low abdominal pain, vaginal bleeding, pain while inserting a tampon, or even during a gynecological examination or test. The list of causes of painful sex is inexhaustible, but right now we'll just talk about some of the causes. They include anything that can cause vaginal dryness. Aside menopause, you can have medications, vigorous exercise, smoking, cancer, and radiotherapy. All these can cause vaginal dryness. Other causes include factors that reduces sexual desire, such as fear, stress, anxiety, relationship problems, low self-image or shame, history of sexual abuse, or even rape. More factors are ulcers in the vagina, example from vaginal cancer. You also have inflammatory causes like vaginitis, cystitis, and pelvic inflammatory disease, injury to the vagina like during childbirth, episiotomy, hysterectomy, during pelvic floor surgery, or accidents that involve the pelvic region, uterine causes like endometriosis, uterine fibroids, endometrial cancer, uterine prolapse, congenital abnormalities like imperforate hymen and vagina, agenesis, infections like urinary tract infection, yeast infections, abnormal growths like cervical polyp and genital warts, and also hormonal imbalances that can result from stress, tumors, medications, hormonal therapy, or even cancer treatment. Detecting the cause of painful sex may be quite straightforward for us if we know your history, we know the associated symptoms, if we look and examine your vagina and just run some basic tests. For example, for causes of painful sex that results from infections like urinary tract infection or sexually transmitted disease, it can be associated with low abdominal pain, abnormal vaginal discharge, burning sensation, pain during urination, smelly urine, and all we have to do is do STD screening, some blood tests, vaginal swab analysis and culture, and we can actually find out the cause. Those related to ulcers, inflammation, uterine causes, and also cancer may come along with abnormal vaginal bleeding and may require blood tests, ultrasound scan, and histological analysis for us to determine the cause. Usually, treatments are based on the cause. Now, if you have an emotional cause, all you have to do is counsel you and possibly do a desensitization therapy and sex therapy for you. Infections and inflammatory causes will require us to prescribe antibiotics or antifungals and steroids to you and your partner. For abnormal growths and cancers, we can refer you to a gynecologist that may prescribe a surgical removal of the growth and possible chemo or radiotherapy if need be. There are home remedies that you can also try out, and that includes sitting down and talking to your partner about the situation, urinating before sex, and also taking some painkillers. Painful sex can be largely prevented if you have adequate foreplay before sex. If you wait for up to 6 weeks after childbirth, you can also use condoms to prevent sexually transmitted diseases, and also use water-soluble lubricants if you suffer from vaginal dryness. Have you ever had this problem before? Don't be shy to share your experience with me in the comment section, for you never know what might help you. If you haven't already done so, hit the subscribe button, turn on your notification, and I wish you a pain-free sexual escapade.